Welcome back. Are you feeling tired, irritable, experiencing some weight gain? I don't know anybody like that. If so, our next guest says it could be something as simple as a hormone imbalance. And joining us once again is Dr. Sharma. He is the founder of New Life Aesthetics and Wellness Associates, and he says he can help with this. It's so good to see you again, Dr. Sharma.
Pleasure.
Thanks for being here. Okay, so let's talk a little bit about biological hormone replacement therapy, because people might have heard this, but they might not know what that means and might not realize that all the things I just rattled off, from the weight gain, the irritability, the whole 9 yards, might be associated with that.
Yes. So this is modern anti-aging medicine, and if you look at it, when you are age 20, your hormones are at the most optimum level, and then every year it declines about 2 to 8%. So when you are in mid 40s, almost half of your hormones are gone, and so it starts showing symptoms of different symptoms, and this is the time when we do the intervention, replacing the hormones, naturally biological hormones, to optimize them, to balance them, to cure their symptoms.
Before I get into who's a candidate, what are some of the symptoms that you find that your patients are experiencing that lead them to want to come and see you?
Weight gain, inability to lose weight, mental fogging, confusion, unable to sleep, lack of energy, so on and
so really it's just, it seems like it could be just anything, like, oh, maybe if I just get a good night's sleep, it'll go away, and you say that's just not the case.
No.
Who is a good candidate, you think, for this?
So anyone in middle age who's experiencing these symptoms which I said, getting fatigue, feeling tired, unable to sleep, unable to focus, unable to lose weight or gaining weight, women's experiencing hot flashes, premenstrual symptoms, feeling weak. These are the people, and almost everyone has some of these symptoms.
Yeah, I'm thinking to myself, I just got 6 of what you just rattled off. So how is it performed then if we're getting this hormone replacement therapy? We come into the office, what actually happens?
Well, it requires an extensive evaluation, because we treat patients at individual, based on their age, based on their symptoms. We do an extensive blood work of their hormones. We check their clinical symptoms, and based on that, we predict what should be the hormone when they were 20, most optimum level. And then we customized a palette which is just specific for that particular person. It's a very small size palette.
Yeah, looking at the size of it, it just fits in the palm of the hand.
Yes, but it is individualized.
Okay.
And then it is placed. It's a small procedure, takes about 5 minutes. It's done in the office, and we place it under the fat pad, under the skin. The benefit of this is it gives a sustained release of those hormones which your body needs. It's not like you can use gel, you can use injections, you can use pills, but they give a roller coaster ride.
Okay, so this is
the level goes up in the morning, or every week it changes, and it affects your compliance. But here, if we identify the problem, if we do the proper evaluation and rightly dose the palette, then it should last for 3 to 6 months. And people start seeing difference in 1 to 2 weeks.
Well, talk about that. Talk about the difference that you've noticed that your patients have shown by coming in and getting this.
It depends on the symptoms they are having. They start feeling more energetic in 1 to 2 weeks, and that peaks in 4 weeks. They are able to do more workout. They start gaining muscle mass, muscle strength. As the muscle is increasing, the body composition changes, their fat decreases, and their body looks much better. They are able to focus better, sleep better, have more energy. Women with premenstrual symptoms or postmenopausal symptoms, they all resolved. So the thing is, the evaluation has to be right, and properly talk to the patients, and if it works, that's the best thing they can get.
And last but not least, what about downtime? If you come in and get this procedure done, you say it takes 5 minutes, how long should we expect to recover from this?
Well, the evaluation takes about 10 minutes. Once we have the blood work, we go over the blood work, the symptoms, and then the insertion takes about 5 minutes in the office, and then you can go back to the work the same day. There is not much downtime at all.
Back to work the same day.
It's a small incision we make, and we don't even stitch that. It's that small, and it heals in 24 hours. So you're back, and you start enjoying the life.
Yes, and looking at all of those positive benefits, as you know, the decreased skin wrinkles. I was looking at that. More memory and concentration. All good stuff.
Well, if you look at it, estrogen, testosterone, thyroid, we look into all the hormones, and every hormone plays a very important role. And what we are trying to do is balance, optimize to exactly your needs, not to overshoot them.
Sure.
So you enjoy that youthful feeling, look, and everything.
Love it. Dr. Sharma, it's good to see you, sir. Thank you for being here. We appreciate it. And we'd like to thank New Life Aesthetics and Wellness Associates for coming on and making the segment happen. For more information, you can visit their website, which is newlifejax.com. You can also schedule an appointment by calling 904-399-4004. And by the way, if you call that number, which is on your screen, you'll get a free consultation, which, by the way, is a $200 value. So just call the number and say you saw this on First Coast Living, and you'll get that free consultation.